There's one reason why we continue to see hamstring strain after hamstring strain. And that reason is that we tend to only fix the symptom and not the source of the problem. So in this video, I want to break down everything from why we see this and what is the root cause, but also how does this show up in your assessment, and then how does that assessment then guide us through very specific exercises to make sure that we fix the source of the problem so the symptom, aka the hamstring, doesn't come back as a problem. So there's really two main contributing factors as to the source of this hamstring strain. Like we said, the hamstring itself is the symptom, but the hamstring is simply following the position of the pelvis and the rib cage. And so why is this position and asymmetry such a big deal? Well, if we take a step back for a second, we can understand that muscles contract when they are in a biomechanically advantageous position. You can think of this as having leverage. So when they're not in a biomechanically advantageous position or a unleveraged position, they won't contract or they'll be in a weakened state. You can think of this as the same thing with a dimmer switch on a light. A dimmer is going to ultimately determine how bright a light is. So we can think about our biomechanically advantageous muscles as being super bright or on, and the ones that don't have leverage as being dim and off. So the asymmetry in the position is going to essentially produce an advantage or a leveraged position for some muscles and a disadvantage for others. So now if we bring it back to our hamstring, we'll start to see that it's really common to have right hamstring strains more than the left. Why? Because we have a natural asymmetry of the human body that tends to pull us slightly to the right. What this does is it makes it really hard to reciprocate back to the left in activities such as walking, running, and performing. And the more that someone gets into this pattern, the harder it is to reciprocate. So what does this do? As someone's walking, as they're running, as they're performing, if they really struggle to rotate the pelvis to the opposite side, it continues to have and produce a mechanically advantageous position for this hamstring to do a lot of work. This is synonymous with our bright light when we think about our dimmer switch analogy. So that asymmetry really keeps someone in that right hamstring. The second thing we'll see is an overall position, and that position is an anterior tilt. So what we see is a nutation of the sacrum where we tip forward, we increase the lordosis in our lumbar spine, and a response from that is going to be a rib cage that is a little bit more flared. This, coupled with the asymmetry, both produce advantageous positions for that hamstring to really stay on during all activities. So we understand that the position and the asymmetry makes it really hard to get out of that right hamstring when shifting with really any exercise. But how do we know if our patient or client is in that position? Well, that's where our assessment comes in. Now, if you really want to get the full details and the why behind it, I encourage you to check out the Performance Redefined program where we go over all of this in a lot more detail. But for this video's purpose, there's a couple key tests that you really want to look for and really observe to help you confirm if your patient or client is in that position. So when we're performing our lower extremity assessment, usually what we'll find is that someone that is in more of that right hip and stuck in that pattern, they're usually going to have better internal rotation on the right and better external rotation on the left. So that means that they're going to have limited internal rotation on the left and limited external rotation on the right. This is essentially a normal outcome or a normal response of being in a position that's to the right. What happens is the body picks up internal rotation because of the pelvic orientation. So they pick up internal rotation on the right and external rotation on the left. Another common finding is that these patients and clients can usually touch their toes. So their toe touch usually looks like it's within normal limits and normal range. The last test in which you might not be performing but should for this type of presentation is a hip shift. Usually when this hamstring strain presents on that right side, our patients and clients can hip shift to the right when they're in a 90-90 position on the wall, but they really struggle to hip shift towards the left. And again, this is just another way that you can really see this asymmetrical pattern play out in their ability to turn to the left. Just like a house, you need a foundation that is strong and in a good position to hold the first and second floor. Well, the human body is no different, and the human body foundation is the rib cage and the pelvis. So the first thing we want to do to start to address the source of this hamstring strain is put the foundation in a good position. Like we said, a lot of times there's an anterior pelvic tilt bias. So what we want to do is make sure we can properly coach our patient and client through a posterior pelvic tuck or tilt. I like to differentiate between the two terms. A tuck is a little bit more subtle and a tilt is a little bit more aggressive. To be honest, it really depends on how much of an anterior pelvic tilt the patient or client is in to really know how aggressive you need to be with a tuck. So when we're teaching a posterior pelvic tuck or tilt, the words, the verbiage, the cues that we're using with our patients or clients is super important. This is a relatively difficult action for them to do in a relatively unfamiliar area that they're trying to move. So what we need to do is not only make sure that they're proficient in how they do it, but making sure they understand why. If the patient or the client doesn't understand the value or the why behind why we need to be proficient with mobility, strength, and awareness of our pelvis, then they're never going to want to do it. So we need to make sure they know that it's our foundation, and in order to really build up a strong foundation, we need to establish that ground level building block, and that's really what the pelvis is. So when it comes to going through a pelvic tuck or a pelvic tilt, all we're going to do is have our patient or client in hook lying, and then I like to put hands on the pelvis or the ASIS so they can really feel the rotation. And the easiest way is to cue them that they have a big belt buckle here, and that if they had a big belt buckle, I want them to tilt away from their ear. So we're taking the belt buckle, moving it away from their ears, their face, their jaw, their shoulders, whatever you would like to use. That's going into the anterior motion. Then we're going to say, I want you to now take that belt buckle and draw it towards your chin. And there's our posterior pelvic tuck or tilt. I like to start going away because this is usually the easier motion for the patient and client. Going into the posterior pelvic tuck or tilt is usually a lot more difficult. Now, if they don't understand the belt buckle reference, just have them arch their back. So say arch your back without anything coming off the ground. Normally they have no problem doing that. Then you just cue them to do the opposite. Next, we're going to go through a passive range of motion hip shift. What this is going to do is start to work the patient or client's ability to shift to the left. But the nice thing is it's passive. So we're going to use a towel under that right hip to automatically turn them and get them into a left internally rotated position. So what this does on the right is it helps to turn off or dim down that right hamstring as a response of the pelvic position. And on the left, it's pushing them over there so they don't have to work for that. But what they can do is they can start to recruit the left hamstring, the inner thigh, some of these internal rotation muscles, so we can start to get familiar with how to capture those muscles and start to really boost the dimmer on those as we keep the ones on the right more dim. So for the passive range of motion hip shift, what you're going to need is a towel that's rolled up or a small Eric's pad and a ball to put between the knees. And you're going to want to do this on the wall, ideally with no shoes, so your patients and clients can really have the reference of the wall. Now, for our example, we are trying to shift the pelvis towards the left. So this towel is going to go under the right hip, which automatically or passively pushes us to the left and does the work for us. Remember, we like to start here so that way the patient or client can just get over there without having to think about so many things. And once they're over there, they can then start to work that left hamstring, the left glute, the left inner thigh, the muscles that we need to work in order to stabilize and get stronger to actually pull the pelvis towards that left side. So for the setup, you're going to put the towel under the hip, and what you'll do is make sure that they're close to the wall. And then you're going to throw the legs on the wall, and you're going to make sure that the left knee is starting lower than the right. So you should be able to see that the left knee is starting lower. That's the outcome or response of the towel under the right side. From here, all we're going to have them go through is a pelvic tuck. So we want to go into that posterior orientation of the pelvis. The rib cage should come down slightly. Then we're just going to start to pull the heel down. So I like to tell people to imagine they're bringing their foot to their butt, but they're not moving it. So all I'm doing is I'm pulling my heel down to the point where it wants to move, but not letting it move. My hamstring turns on. From here, we're going to slowly push into the ball, and then we're going to try to draw down and use the ground as a reference to turn the glute on. So left hamstring from pulling the heel down, left inner thigh by starting to push the ball in on that left side, and then the ground being the reference to push the glute into the ground, all without falling out of that nice posterior pelvic tuck. Again, we're starting to build these muscles on a strong foundation, and that comes from maintaining that neutral or stacked position of the pelvis under the rib cage. Next, we're going to an active range of motion hip shift. So what we're going to do is remove the towel that we had for our passive range of motion, and now we're going to make the patient or client own their motion. What they'll need to do is own the motion. They need to learn, how do I shift over to that side, and how do I do it in a way that's not overworking the right hamstring, and it's doing it by turning the right muscles on like we previously talked about. So the active range of motion hip shift is just like the passive range. We just don't have the towel under the right hip. The goal of that is to let the patient or client own the hip shift. They have to now use the right muscles and maintain the right position to then shift over. So I'm going to go through this one a little bit quicker because we just went through how to do it passively. The steps are the same. The only difference is that the patient or client is working to get themselves over. So you'll still want the ball between the knees, no shoes on so you can keep the reference of the wall. And all you're going to do is get them to go through that tuck. So the pelvis is under the rib cage in a nice stacked position. We're then going to press into the wall, draw down with the heel, gently push in, and then we're going to start to reach the knee toward the wall on the right and draw the ball or the knee on the left down towards the ground. Again, this isn't a big range of motion, but what you want to really watch for, and you can even cue, is that the knees are synonymous to pistons, and pistons that can only move straight up and down, not laterally out. That's what you're going to really start to see, is this shift towards that side. So they need to be able to draw down, maintain this kind of straight plane like a piston, and not deviate out towards that side. When they do it, they should start to kick on the glute, the inner thigh, and the hamstrings, as we previously talked about, while maintaining that good position at the pelvis and the rib cage. Lastly, we're going to go through a standing hip shift with a slant board. Now, this is more of a frontal plane exercise, but it's a great way to use a slant board to help the patient or client turn the pelvis and get into that left hip. What we're searching for when they do this is that they feel their glute and that hamstring on the left while keeping the right side relatively inactive. So for our lateral hip shift, what we're going to need is a slant board, and ideally your patient or client without shoes, so again they get the reference of what's going on at the ground beneath them. So this is a little bit more advanced compared to the others, but it's the same principle. We are working on turning the pelvis to really learn how to shift to that left side and pick up some of the key muscles, those key muscles being the glute, the inner thigh, and the hamstring, that are really responsible for getting us to that stance leg during gait, during running, and during performance. So all we're going to do is we're going to use the slant board. We're going to step, so we are going with the lateral aspect of our foot in an elevated position. We're then going to shift over to that side, and what I want you to think about is your nose being over the toe. So the wrong way to shift would be just shifting the hip and not actually the body. In this position, my nose is still in the center of me. So what we're looking to do is we are shifting nose over toe We're keeping this leg straight, and we're going to drop down, almost like we're going to a somewhat of a mix between a squat and a hinge. So we're going down, we're going to have elbow over the knee, and the other arm's going to be back. This is working on turning into that internal rotation position that we're looking for at the pelvis on the left side. The second I turn, I pick up that left glute. I feel a little bit of hamstring, but really that left glute. We're going to go down, maintain your toe contact, maintain your elbow over the knee, bring the arm back, hold for about 5 seconds, should again feel that glute, and then we push off. And you can make this a little bit more dynamic where you're going down and sinking into it, hold for about 5 seconds, push off. Every time you go down, you're searching for the glute. Every time you come up, you're pushing with the glute. So as you can see, with all of these exercises, we are not really indirectly going after that right hamstring, which is the problem. Well, hopefully after this video, you're seeing that it's not the problem, it's just the symptom of the problem. And in order to get rid of the symptom permanently, we start to fix the source. And all of these exercises had similar components where we're trying to take the pelvis, we're trying to remove it out of its natural bias of a right internally rotated position, which gives that right hamstring leverage. And instead, we are working on turning the pelvis. And when we turn the pelvis, we start to dim this right hamstring and put it in an unleveraged or a disleveraged position and start to actually leverage the left side, start to gain a little bit of symmetry and get the person in front of you comfortable and confident feeling the left hamstring and feeling the left glute and feeling the inner thigh, the muscles that really help us reciprocate gait, performance, running, whatever the sport or the activity is that the person in front of you does. So the next time you're working with a hamstring strain, I encourage you to try this approach. Move away from the symptoms, raise your standards to try to really fix the problem so it doesn't come back for the patient or client. Let me know if you have any questions. I'd be glad to answer them in the comments below, and I'll see you guys in the next video.